So I think that acquisition of an accurate history is really, really important. And I always try and speak to the owner or rider directly, or the groom. Because sometimes if it's at a show barn, the groom actually knows more about the horse than the trainer or the rider or the owner. And therefore to talk to the person who's interacting with the horse the most, I think is very important. And I want to get as much information as possible. Some of that information may be absolutely misleading, but some of it may be an absolute gem. And if I haven't got that, I'm going to miss some important piece of the jigsaw that I need to be putting together in terms of putting together the whole clinical picture. And as I'm talking to the owner, the rider, whoever it may be, or the person that looks after it, I'm also observing the horse to see how the horse is standing, what its general demeanour is, how it's interacting with the holder. If the holder starts using their mobile phone, I'm afraid I'm a little bit abrupt and say, please focus on the horse because you are responsible for my safety. And if the owner is not paying attention, I will always say, please make sure that you are always on the same side of the horse as me, so that if the horse does anything wrong, then we're both going to, the horse is going to come this way and its backside is going to go away from both of us, which is going to place us both in a potentially safer position than if we were on opposite sides. And I really do like the handler to be focusing on the horse, because I'm going to be reliant to some extent on them for my safety. I'm watching everything, but they are going to be the person that notices something the quickest potentially if something's not going right. And I want them to alert me if the horse is suddenly becoming hyperreactive or more vigilant than it was previously. And I also want to look at the attitude of the horse. This horse was looking about itself, and I thought that's nice. I don't like it when we bring the horse into a clinic situation, for example, and the horse just stands there with a lowered head and neck posture with this kind of intense stare in its eye, not engaging with us, because that tells to me this horse has probably had chronic pain for some considerable time. But we can see that this horse's head has been above, head and neck have been above a horizontal position all the time. The horse has been looking at its surroundings most of the time, which is a nice thing for me to see. I'm looking to see about how the horse is choosing to stand. Now at the moment we can see it's resting its left hind and it's got his right front in front of the left front. And I would ask the owner, is that a normal posture for this horse, or is it?
He's always resting a leg or something. He's very casual.
Right. I think if they say he's resting the left hind much, much more than the right hind, that's a significant observation, because most horses will alternate the hind limb which they rest, and it will be for approximately the same time. Not necessarily in the period of time that you spend watching the horse, but overall they will equally shift weight between each hind limb. I think that some horses do preferentially put one forelimb in front of the other. We know from studies done in young warm bloods that some have a preference to graze with one particular leg in front of the other. And as a consequence of that constant position in grazing, say with the right forelimb forward and the left hind limb behind, they will have a lower heel on the limb that is protracted and a higher heel on the limb that is retracted. And they start developing this as foals, and it will persist with them throughout the rest of their lives. So we see he's just switched his hind leg that he's resting, and he's done that throughout the time that we've been standing watching him. Now, we learned that this horse is a 12-year-old. He's an off-the-track thoroughbred. He came off the track about 7 years ago, and he's got up to 3-star level eventing. So he's been a pretty smart athlete, I would say. One important feature from the history that Becca didn't mention was that he actually went lame at an event. He'd done the dressage, he'd jumped, and then the next morning in the stall he was standing non-weight bearing on the left forelimb with the limb in a semi-flexed position. And this is a characteristic posture that we call root signature posture. That's a term that has been adopted from small animals, and it signifies that there is a likely presence of cervical nerve root pain. If It's a very typical posture. We could possibly see that if the horse had a fractured olecranon. We could possibly see that if the horse had radial nerve paralysis, but then you would tend to see more dropping of the elbow. And from the description, I don't think that's what the horse showed. The horse it's the diagnostic procedures that were carried out after a period of rest when the lameness persisted, and it was a left forelimb lameness, sudden in onset, I say with root posture signature initially. He did have diagnostic anaesthesia performed up to the subcarpal level with negative results. The horse then underwent CT. I'm not sure exactly what was observed on the CT, but he did have injections on the left side of his neck from C5 to T1, and also on the right side of the neck, which I presume was based on the imaging, from C5 and 6. Becker is not sure whether it was the joints, the articular process joints that were injected, or whether it was the nerve roots that were injected. He has improved progressively, and Becker now says he's not 100%. She particularly notices something if she's cantering over a pole, when she describes that he feels as though he picks up his shoulder, and he has a rather choppy canter, which he doesn't show on the right rein. She's never felt historically that he had a problem turning to the left or to the right, never appreciated any undue neck stiffness. He's been in moderate work, flat work, since October. And that's about it in terms of the relevant history to the most recent problem. He historically did have a check ligament desmotomy on the left fore as well.
That was the right.
Oh, the right fore, the right fore. But that was several years ago, and he made a complete functional recovery. So looking at this horse, can we just see if he'll bear weight on the right hind limb, please? My immediate thought when I looked at this horse over the stable door is that this horse's neck musculature and the back and pelvic musculature don't really match. For an off-the-track thoroughbred who's an event horse who has to do dressage, he's got a pretty good neck in terms of the top line of the neck. He's not particularly well muscled over the lower parts of the neck, and that's pretty symmetrical by feel on both the left and right sides. So I think that I would expect to see better musculature around this corner here, and the same on the other side. But what I was more focused on when I looked at this horse, I thought, my goodness me, he's got these big concavities behind the scapulae on each side. The most common reason for horses developing concavities like that is that they've had a saddle which hasn't fitted ideally. And that could go back, way back. It could go back to his thoroughbred racing days. And even with a well-fitting saddle, some horses never properly develop the muscle mass that they failed to develop or they lost due to the ill-fitting saddle.
Is that true for Western saddles as well as English?
I think so, yes. It's just an effect, it's a pressure effect. And the other thing that I observed, can just see if he'll bear weight again on both hind limbs, is that, maybe, go. To me, the whole thoracolumbar pelvic region is not as well muscled as I would like it to see if this horse had been working correctly. Now, I haven't asked Becker yet about what is the quality of his flat work. What scores do you get percentage-wise when you're doing a dressage test?
Percentage-wise, it's usually low 30s.
Low 30s.
For eventing, so.
So that's penalty-wise?
Yes.
Penalty-wise.
So about just high 60s then.
High 60s. So that's okay. Could be better.
He's gotten into the 70s. But
okay. And so what sort of comments do you get from the dressage judges?
Working like at home and in comparison to like at an event, he's very, I think it's more so me that I put the nerves into him, and he gets a bit more tense in the show ring. which we're working on.
So what do the judges say? Is there some consistent remark that they make?
It's always lovely pair. um, but it's always, especially when we made the move up from prelim to intermediate, just getting his frame for like further like through.
Yeah, that's exactly what I expected to hear. This horse is not working properly through its back, and it's not probably pushing sufficiently from behind.
Never, like I've
He's
always,
never. Well, he's always
I've
had a
always
push.
been told he needs to work from his butt harder
Yeah.
than he does.
Yeah. And she blames herself for the horse getting tense. My immediate reaction, having looked at this horse, is probably this horse is struggling a bit with its flat work because it's probably got some low-grade discomfort, and that is reflected by the lack of development of the muscles of the thoracolumbar and sacral region and the pelvic region as well, because I would not expect in a horse that is working correctly to be able to see such prominence of the spinous processes, particularly in the lumbar region. And I've got this concavity between the lumbar spinous processes and the tuberous sacrale. That's not normal in a horse which is working correctly. So I think it's really important to look at the horse and assess its musculature, and I think I can predict how the horse is going to work under saddle or how it has been working historically. And Becca is very humble because she says, oh, I think it's me, I get tense and the horse gets tense. I suspect that there is an element of you predicting what's going to happen, but also the horse knows that this is going to be physically quite demanding. And horses who find things physically more demanding get stressed, and that comes out as being tense, whereas the horse should be calm and relaxed if it is working in a pain-free way, because she would have put in the appropriate training. So, and still working at this level, it should be relatively easy. But this is a very common finding, I think, in off-the-track thoroughbreds. We know that
Have like a little hump in his lumbar.
yeah, I mean, it's not a hump. This is the normal shape and orientation of the lumbar spinous processes.
More prominent.
But they're just more prominent because there's lack of muscle development through here. And when you have this concavity between the tuberous sacrale and the lumbar spinous processes, that often reflects that they've got some element of lumbosacroiliac joint region pain. The fact that the hindquarter muscles are not as well rounded as I would expect to see tells me that this horse has not been pushing adequately from behind for some considerable time. So this horse, when I look at it as a whole, come on, let's look your best rather than your worst. That's a little bit better. Has got a really quite nice front, particularly the development of the top line muscles of the neck, but the back doesn't match. And a horse which is working correctly, the horse should fit together, and this horse doesn't fit together. I also want to assess the relative heights of the withers and the tuberous sacrale. So which are higher, the withers or the tuberous sacrale? Tuberous sacrale, yes. Now, if you look at conformational analysis of clinically normal horses, the withers are higher than the tuberous sacrale, or they are at a similar height. To see that the tuberous sacrale are higher than the withers tells me one of two things. Either this horse innately, as from a young horse, has always had the tuberous sacrale higher than the withers, so this was how this horse developed innately, or the horse has changed its posture because of chronic discomfort, and through that change in posture, he's changed the orientation of the pelvic region. The pelvic region has become more sloping, and as a result of that, the tuberous sacrale have become higher than the withers. So this is not a normal conformation. I can't say with certainty whether this was innate or whether it is a postural adaptation. When there is a postural adaptation, you will get all sorts of myofascial tension, which will maintain that postural adaptation.
I've seen a couple horses that have a dip right between the two tuberous sacrale. Does that have anything to do with confirmation of
No, I
that?
think you would find that in many, many horses, and it develops a little bit about what their body condition score as well is. So if you've got a very high body condition score, so they're obese, then you're more likely to find
Like
a
it's
little bit.
dip in between
Yes,
the
yes,
bones,
yeah,
right?
yeah,
It falls
exactly,
in between.
exactly. So they've got a lot of fat and muscle on either side, but not between the bones. Yes. Um, um, so yes, this is just reading the horse whilst I've been talking to the owner. The other thing that I've observed is that the front feet are not symmetrical. The right front foot has a lower heel than the left front foot. Has he always been like that?
Yes.
Okay.
And like 5 years ago,
Yeah.
we had to change like his shoeing to help him out.
Mm-hmm. And has he always had pads?
Yes, for the last 4 years. Yeah.
And do you think the application of pads made any difference to his movement?
Yes, he had the soles of his feet were pretty weak. So we did the pads, and he had Echo Pack in there just to help him out because he's got the good crumbly thoroughbred feet.
Yeah, yes, they are. Particularly the right front foot is.
That has been a special case. Finally found what works for it.
Okay, and so do you do anything in terms of foot maintenance, in terms of his hoof capsules? Do they get painted with anything? Or
Yeah, it's a hardener.
okay, fine. So do you think that his back and pelvic musculature has changed over the time that you've had him, or is this normal for him?
I will say I've noticed other people and myself over the last year or so being like, oh, he kind of looks better with a saddle on than without. But I mean, he went down in muscle quite a bit from when he had the surgery 2 years ago. And then like now, since he's been out since like July, he's still not like, I'm not doing a hard work like up to like getting ready for a competition quite with him yet. So I think we're still working on getting muscle back from being down for so long. But I will say like his back was kind of like that before he got injured. Yeah.
Okay, okay. Right, so everything is starting to be put together as a pattern in terms of how he has been working historically, now that we've learned and questioned a bit more from the rider. My attitude is that we should try and always have a holistic approach to the horse. So rather than just going firefighting and saying, oh yeah, okay, he's got a left forelimb lameness, say how is the rest of the horse as well, so that we can approach the whole horse in terms of our overall management.
How do you differentiate between muscle development due to work and muscle development due to nutritional levels of protein?
Well, then if it was related to nutritional levels, then I would expect the whole horse.
So his neck.
Would also be. But here we've got disproportionate stuff. So that's easy. Now, what I can't say is this atrophy or failure of development or a combination? Because he's an off-the-track thoroughbred, he's going to be worked very differently to a horse that's an event horse. So he's got to develop different muscles as an event horse than he had as a racehorse. And then there's the combination of effects of saddle fit and the pattern of work and how much he feels he can do. And I think that there are many off-the-track thoroughbreds that can be successfully rehabilitated, and they can do a job to a certain level, and then the intensity of the work gets such that it then begins to be a little bit more uncomfortable for them. So to go up the levels becomes more challenging. Quite a lot of them, if they're a good jumper and they love jumping, their jumping will outstrip everything else. And everybody says there's nothing wrong with the horse because he still loves to jump. I think that's a fallacy, personally, that there are many horses that can overcome discomfort when they're jumping because adrenaline rises and they get a dopamine hit and there are all sorts of good things going on and they like it and they're going in straight lines and it's relatively easy for them. So which is very, very different to going round and round and round in an arena, which they find rather uncomfortable and rather boring, and so therefore just because a horse continues to jump and as far as the rider is concerned jumps well, doesn't necessarily equate with the horse being pain-free. So when he's jumping, does he prefer to stand off a fence or get deep into a fence, or doesn't it make any difference?
He'd do a long spot all day long if he could.
Right, okay, perfect answer. Horses with musculature like this and probably associated discomfort like this don't like getting deep into a fence, and they will always try and stand off. And if they get deep into a fence, they're likely to take a rail. Or if they're going cross country and it's something really difficult, they may say, I'm stopping here. Because these horses can jump from a long way off and get sufficient power. They get close to a fence, they find it really difficult to generate sufficient power. So that is a very typical way in which they adapt to jumping, by having this particular technique.
And when he was younger, when we were developing him, he would like to just push off his left instead of evenly off both hinds.
Okay, okay. But you've never recognized a problem with the right hinds other than that?
When I brought him down here like 3 years ago, he was kind of string halty, but we ultrasounded it, we had stuff done, and they never found anything that raised any concern.
Okay. Right. I normally do my physical examinations in a stable or stall because I think the horses tend to be more settled. We're doing it out here, one, because I like the sun, two, because I think the lighting is a whole lot better for us to see the horse, and three, because it's much easier to demonstrate to a group of you outside, and four, I think this horse is going to be really nice to work with outside, so that makes it easy. But there are some horses that will be really hyper outside. I want everything to be as easy for me, so it's going to be as safe as possible for me. But I think we're going to be hopefully pretty safe out here. I always start with my palpation bar at the head end and then work caudally. There's not a right and a wrong way with it. I don't do an oral examination of the horse's head from the start, because I think that some horses don't like having their mouths open, and I want to start with us having a nice relationship and make the more difficult things come later in the examination. Because I do my initial examination in the stall, I tend not to assess the symmetry of the hindquarter musculature until I get the horse outside. But we are going to assess hindquarter musculature now. So perhaps if you could turn that way and then see if you can get the horse to stand squarely behind for us, please. Good boy. And I'm just going to pick this one up. So I would say that the left hindquarter is slightly less well muscled than the right. The tuba sacrali are relatively symmetrically positioned. I always pick up the tail in order to look at the symmetry of the hindquarter musculature further distally. And again, I think there's more muscle mass, slightly more on the right than there is on the left. We'll just position him again slightly to see if we make any difference, because they're not precisely square. Good boy. Now we've got him standing slightly more square, I'm going to change my mind. Because I would say actually now the right side looks slightly less than the left, and I am happier with him standing more squarely. So,
Could you speak up a bit when you face him that way, please?
So now I think that the right hindquarter is less well muscled than the left. And when I feel it, it feels flatter than the left. So there's a definite difference. And if we remember from her description of the jumping, he didn't push off the right hind limb as well as the left. And when they don't push off, it's generally because they don't want to push off so strongly. Okay, so now I'm going to start with palpation. Do we have Rebecca? Rebecca?
Just going to get a microphone.
Oh, right, okay. So, you...
When, are you just kind of typically about tail's length away when you're looking from behind, or do you find like a distant exam, like to be a little further back, or
No,
kind of your preferred spot?
No, I was closer to the horse than I would normally be because I'd seen he kept shifting weight and he never stood in the entire time before standing weight, bearing weight evenly on both hind limbs. So I was trying to make sure that he stood on both hind limbs. I guess this would be my preferred distance. But it does need to be on a level surface. Okay, so we're going to come back and probably you're best on this side. And I want the horse to know who I am. Horses have a much greater smell ability than us. They're more like a bloodhound in terms of their ability to smell than we are. And I think we need to be aware of that. So if you've got alcohol on your hands, that's probably not a very good thing. And they like to sniff you. And I think it's work time well spent allowing them to know who you are before you suddenly jump in. And people say to me, well, why do you spend all this time? And I think it's time really well spent in terms of it's going to make my job easier. I'm going to find the horse easier to handle. So we're going to have a better relationship. And I want to establish that good relationship from the start, because that may be that I'm going to finish up putting in 10 nerve blocks possibly. So I need to have established a good relationship from the outset. And it's going to facilitate my interpretation of the responses to palpation as well, because if the horse is really hyper, it makes it much more difficult to assess the response to palpation. And there are some owners who've never taught their horses to stand still, and I think that makes our job potentially difficult. But it doesn't take terribly long to teach them to stand still, which we can do by positive reinforcement. So if the horse stands still, I can go and give them some food so they know that was a good thing. They move, I don't do anything, they stand still, make a noise, mark the good response and give them food. And I can continue, and within 5 minutes or so, I can get a horse that was fidgeting all over the place to be standing still. If the horse is really, really, really hyper, then I sometimes think it can be worth doing mild sedation just to take the edge off them so that they don't find it as a stressful situation. So I'm doing it to relieve their stress, to put them in a more easy situation. It's not going to stop their reactions to what I'm doing, and it's certainly not going to stop their ability to kick. In fact, that it may make their ability to kick with less warning signs for us. So you just need to be a little bit careful if you've chosen to sedate them. And it's not very often that I need to do that, but it is just occasionally. And then I think can be very, very useful. So as I say, I don't in my initial examination deal much with the head because I don't want to antagonize them. But I then come down and palpate the brachiocephalicus muscle. And this horse is really nice and relaxed all the way down. I then put pressure over the region of the articular process joints and I get no reaction. I'm then going to stroke the neck to see if I get any abnormal reaction, and there's nothing at all. And then I look at the symmetry of the pectoral muscles, and I both look and feel, because sometimes looking alone can be misleading, but palpation as well gives you more information. Now I'm going to switch to the other side and do exactly the same thing. Feel the brachiocephalicus muscle. No abnormal reaction. Palpate over the articular process joints. No abnormal reaction. And then stroke the muscles underneath the mane. Absolutely no abnormal reaction. Now, when this horse initially had its severe onset left forelimb lameness and was standing with root posture, I would like to bet that this horse would have been hyperreactive to palpation somewhere in this region, because when there is nerve root pain, they normally have hyperreactivity, and they can have hyperreactivity even to just very, very light touch. So they have allodynia. So light touch, which you would not expect to create any reaction, they are hyperreactive to. And that often will last for several hours. They might start to stand normally, but that reaction to palpation will often persist for several hours. And sometimes they will have diffuse sweating in the region as well, maybe unilaterally, maybe bilaterally, which may be a sympathetic response to the pain, but also it may be some disruption of the nerve supply as well. But they can respond and recover sometimes remarkably quickly. I was at a training session, a coaching session for trainers, and there was a jumping lesson, and a horse landed over a fence, was immediately non-weight bearing, was a little bit ataxic as well, pouring with sweat within minutes, and then within about half an hour was able to walk off reasonably comfortably. Wasn't sound at the trot, but could walk off quite comfortably. Very alarming to an owner, but actually when you know what's going on, you can say with reasonable confidence, I think this horse is going to be better quite soon. Okay, so we didn't really talk about other aspects of limb conformation. When we look at this horse, he's got fairly long sloping pasterns of both forelimbs. Does that matter? Probably not. And he does show he has greater extension of the front fetlocks than some horses will have. What we want to know is that symmetrical? In fact, does it change when I make him weight bear on a single limb? And no, it doesn't really. I want to look at his hoof capsules from the front and say, do the hoof capsules look reasonably symmetrical? And they're not really, because the whole hoof capsule shape is different in the right front than the left front. But most importantly, I want to look, good boy, at the levelness of the corollary band. Is it of similar height on the medial and lateral aspects? And yes, it is on both front feet. I want to look at the hoof wall rings. They're not necessarily equidistant because he has variable nutrition, but they do remain relatively parallel all the way around from the dorsal to the palmar aspect. And that's important because if a horse has had even subclinical laminitis that you've not been aware of, but they are a footy horse, and if you look at them radiographically, they have increased thickness of the hoof wall dorsally, then often the hoof wall rings at the heel will be slightly divergent. So paying attention to the orientation of the hoof wall rings, I think, is important. So then, as again, there's not a right and a wrong way in terms of how we start palpating. I start at the top of the limb and work distally, and always try and think about what are the muscles that I am palpating, and is there any abnormal reaction? If I'm palpating the cranial and caudal eminences of the greater tubercle of the humerus, I'm thinking, yeah, that's normal muscle coverage there. So I'm constantly trying to revise anatomy all the time whilst I'm palpating. And if I do the same with every single horse, then I am much more likely to pick up abnormality when abnormality is present. It takes me a very long time to do this when I'm talking about it to all you lot, but on a day-to-day basis, this is a very quick procedure because I'm just doing it on an automatic pilot effectively.